So, when did counseling stop being about problem solving? Well, not anymore. Introducing solution-focused counseling with the unlicensed counselor. And now, here's your host, Steve Moak.
Well, hello and welcome to another episode of The Unlicensed Counselor. My name is Steve Moak, and I am the Unlicensed Counselor. As always, so grateful to be here on a nice, steamy, hot Arizona Scottsdale day, right? Boy, I'm excited to be here. Got some fun stuff cooking today. I got a guest in studio, good friend of mine, Dr. Chris Spencer, that I'm going to introduce here momentarily. And we got a really interesting topic. I want to let him talk about his background and have some really interesting kind of alternative medicine stuff that I want to get into with him as an expert as well, too. But before we kick off this interview today, I want to take a second and say thank you to our friends over at BetterDrugTest.com. Look, you know I'm a big proponent of at-home drug and alcohol testing. If you need an at-home test, pick up the BetterDrugTest.com kit. Go to their website, order it, ship it right to your home. No fuss or muss with insurance. They send it, you send it in back to a lab, and you get discrete results securely sent over to you. So go to BetterDrugTest.com. As always, I like to plug the nonprofit work that I do here at thestopstartshere.org. It's really strong, bold, impactful youth drug prevention messaging. I mean, it's stuff that I'm very passionate about. You know I'm in long-term recovery from drug and alcohol addiction, so I want to make sure I continue to help the parents and the kids as they go back to school. Check out our Parents Prevention Playbook at thestopstartshere.org. Have a new sponsor this week. Drum roll, please. I want to introduce that I think is a really cool idea. And I reached out, started talking to them. The concept is trash can advertising. So it'd be ads on your trash and recycle bin. Go to buzzbinmedia.com. That's B-U-Z with one Z, B-I-N media.com. And the way that it works is you just go to the enrollment page. You sign up. It costs nothing. There's no strings attached. It's really that easy. They send you out decals once they get enough signups in your area. Right? And you'll get a sticker that goes on to your trash or recycle bin, and then they pay you $10 every single month for the ability to have that on your bin. So, kind of a cool concept. Their startup wanted to help them out, so I'm putting this out there to all the world. Go to buzzbinmedia.com, find out, enroll, and let's get started. And again, as always, follow the Unlicensed Counselor on all the usual social media channels. Okay, enough of that nonsense today. So, I want to introduce my friend, Dr. Chris Spencer. Chris, it's great to have you in studio. Thanks for taking a couple minutes out of your day. So I want to give you the chance to kind of introduce yourself. First, from a professional perspective, I know you as a chiropractor, as a physical therapist, who's somebody who's helped keep this 45-year-old body working. I've gone in and seen you. We've become friends. So give me kind of your professional background first, and then I have some interesting stuff that I want to get into that I know you're an expert in as well, too. So maybe go ahead and tell the audience who you are first.
Yeah, my name is Dr. Christopher Spencer. I'm the owner and operator of Balancing Health Solutions inside of the village at Gainey Ranch, where I take more of like a multimodal approach in treating and assessing my patients. Rather than just being in and out with your doctor, you're going to get one-on-one care for like an hour. And a thing that I'm big on is educating my patients. I think that's the best tool that I can really give them is the education to manage their own conditions without having to be relying on me. So, yeah.
Well, I'll say this too, as a client, I'm here raising my hand as well too. Your work is great. I've gone to other, PT places and had work done, and I swear I get 15 minutes with, the actual doctor, and then I get 40 minutes with like the intern or whatever it is, or they give me a piece of paper and here's some exercises. And I'm like, well, okay, that's great, but I really want the time with the actual expert to help me get through this, right?
Absolutely.
So when I went and visited with you, I mean, you get a whole hour of getting work on. And I mean, that was lasers, it was the cups, it was the wave therapy that we did last time.
Yep.
I mean, I don't know, but all I know is I felt good when I was coming out of that. And yes, at the Gainey Village here in Scottsdale, Arizona, if you need to see Chris. You have a website you want to plug as well, too?
It's www.balancinghealthsolutions.com.
Excellent. Well, and I highly recommend him as well, too, just to all my potential listeners out there. We got a lot of people in Arizona. Go visit Dr. Chris as well, too. So, one of the interesting things that as I've gotten to know you outside of just kind of the doctor-patient setting where you're fixing all of the ails that come up with on a weekly basis for me, is I've gotten to know a little bit about your background and your involvement with some of these I don't even know the best term yet, and I want to get your opinion on this, kind of plant-based medicines, alternative medicines, and I'm talking about more of like the stuff that you go on retreats and take and things like that. You know, I'm a person in long-term recovery from drug and alcohol addiction. I've done the mushrooms, I've done the acid, I've done the mescaline, I've done all of that stuff. So, you know, I'm curious if that's been a part of your story as well too. But what I'm really interested in is some of these kind of the ibogaine, the ayahuasca, there's some of these DMT, like it's stuff that kind of, since I hung up my shoes on the kind of career of trying things, and I hate to call them drugs, and I'm not trying to judge them in that way. Yeah. But I am curious, is it's kind of a new thing. You hear Aaron Rodgers doing these retreats. You hear a lot of celebrities doing these things. So if you can maybe educate me on maybe what some of these retreats were like, maybe some of your first exposures to it, what drew you to it, and then maybe we can start going into some of the benefits and what you've learned and kind of educate the audience.
Yeah. So, I mean, you can call them psychedelics, you can call, which I'm not fond on, but I like the term plant medicine. And then I've even drifted away from that because I think that the term medicine implies that the person isn't whole. And so every individual that I've ever seen is whole, even though they may be working on things. So I almost think of plant technology in a way.
Yeah, that's new.
Kind of
I haven't heard that
and that's
before.
one that I kind of heard from one of my mentors or shamans that I've worked with in the past. And within my profession, I would say one thing that I see is that pain that shows up in the body is often just trauma that's been suppressed over time. So it's living very unconscious and unaware of being in our bodies and how they function and the things that are affecting us. And so that's also part of the reason I spend like so much time with my patients, because as I get to know them, I get to understand better what's going on in their life and what's attributing, because pain is a multifactorial problem,
That makes
right?
so much sense. And is that, you know, again, not to pry too much, is that maybe why you started exploring some of these alternative medicine? Again, I'm going to just keep using some of these terms as I learn through. But as you became, is that what maybe drew some of the stuff in your past that kind of drew you to medicine? Or maybe, I'm not trying to throw trauma at you or anything like that, but maybe you had some stuff that were going on. It was like, maybe this is something that could open my eyes or help with that.
Yeah. I mean, I think I've always been a seeker, and everybody's grown up with trauma in some form or fashion, right? So, I went through my years of drinking heavily and partying heavily, coming to understand I was just covering things up. And during grad school, I had, dealt with some other traumatic events, like one of my best friends passing away. And so, during that time, rather than slowing down, I sped up. I worked harder. I worked out harder. I just pushed myself further just so I wouldn't have to think about things that occurred or that happened.
Gotcha.
And so we do that in different realms or different areas of our lives, where it can be studying harder, pushing our drinking, whatever, we're just covering things up often. And I got to the point where I was just tired of I was just burnt out, and I was looking for alternative ways to really manage these issues that I had suppressed for so long. And I'd gone to therapists, but I think that is I don't think it's the best route, right? Because you can get caught up.
You're not going to offend anybody in this studio, right?
I mean, I think there's good things about it, but I think you can get caught in a trauma loop where you're just talking about your story over and over.
I agree. We've done episodes on this podcast similar. I'm not sure just repeatedly talking about the same thing doesn't kind of continue to foster the problem a little bit. So I'm not putting down, the show's called The Unlicensed Counselor. I went to graduate school for counseling, but didn't do my practicum and didn't get licensed. So I kind of take it, but I was also surrounded by people who were going on to be licensed counselors. And I saw, the education that they got, so how they're trained in order to be counselors. And it's like, talking back and forth. And I'm going, I like talking with, some goals, and I'm not trying to drag it out over years. Right. I think in weeks and months with agendas and kind of focus and measuring progress and things like that. But I agree that just talking isn't going to get you, at least a lot of people, where they need to be. And that's why I think other modalities like this are super interesting.
Yeah. And so then during that period, I was always researching different things, anything related to the body. I've always just been interested in, and I started talking with some friends and then developing an interest in plant medicines and herbs and then plant psychedelics and things like that. And so during grad school, we had to write a 30-page research paper for our capstone. And so I chose to write mine on psychedelics and their benefits in treating things like PTSD and anxiety and depression and how they stimulate adult neurogenesis and neuroplasticity. And then I started experimenting with them. Usually I start with anything I do, I educate myself,
Sure.
then I want the experience for it,
right.
right? So, but I took it from the standpoint of a scientific standpoint. I was always just looking at like, oh, it's increasing my neuroplasticity or my, and so it was like, I wouldn't do like have the right like preparation or intention going into doing it. I just thought you just took it and that's what you did.
Yep.
I wouldn't be in the right environment or the right setting, not realizing that when my brain is neuroplastic, well, I can have positive things that can come in during that time or negative things that come into that time and affect the bad trip, which is mostly right. So, and then the most important part is like the integration. So whatever you learn during that process or unveil, it just helps you tap into your subconscious or things that you have been suppressing. It's like, okay, how am I going to go about my life and actually make the changes that I need to make? It's like being newborn a lot of times. And it's easy. People just fall back into their patterns because I think we're so used to Western medicine and how it's like we take something and we get the results that we want instantly. So I've seen plant medicine and personally have done it in the wrong fashion, I would say. And I've seen a lot of people do that in the wrong fashion where they're just going in and they're having the experience. And then it can become similar to talk therapy where it's like, oh, I'm just going back and doing my medicine. And it can feed the person's ego in a bad way. They're like, makes them feel enlightened or better than everybody else. Or it's
I feel like I've seen
I see it all the
examples of
time.
that.
I see it all the time. I'm going and doing my,
Yeah.
and they take it over the top, and it's just like, well, that's not like the real work. The plant medicine just opens you up, but it's
That's
you.
the kind of start of, not to use the word journey, the kind of trip sense. It's the journey of the integration part back into life and the lessons learned and kind of the follow through. Is that kind of more what you're referring to?
Yeah, the follow through, because it's going to make you open your eyes to seeing things that you don't want to see a lot of times, right?
So can I ask a question, just so I can help the audience along the way? Neuroplasticity. I'm familiar with the concept, but maybe if you could explain it in a simple way that the term could, maybe so the audience understands what that is more.
Essentially, it's the growth of new neurons and new neuronal connections, right? So it allows your brain to change habitual pathways or
like
patterns.
A rewiring.
Rewiring,
right?
Yeah, absolutely, like a rewiring.
That's what I've heard, and I've heard that term thrown around, and I don't know if everybody necessarily knows what that is, but I think that's really key, and that's why I want more research into a lot of these medicines and things like that. I've been involved in AA, and they have certain perspectives on drugs and alcohol, and I'm like, I understand it, but I am for medicines that help people. Like, I don't think we should, if there is something for ketamine. Now, I think a lot of this stuff currently right now is kind of being labeled under the guise of medicine when it looks a lot of like just still recreational. I'd really like real research done on these things to find the true efficacy of these things as well too.
Yeah.
Because I want people to get better. And if this is a way to get better, like, let's study it. Let's find a way to do it.
Right. Absolutely.
That's my 2 cents. Now,
100%.
I'm curious on, maybe if you have a retreat or a couple retreats in mind that you've done, if you could walk me through, what the process of signing up for ayahuasca and then the trip. I'm talking about the physical trip down there, the time while you're spent there, and then actually the ceremony, the shaman, what you experienced, kind of what you were nervous about beforehand, and maybe what were some of the things that you gained from some of those experiences. If you have a couple that maybe stand out, I think it's interesting, and then I'll share some of my thoughts on why I've been hesitant to do any of this stuff just as a recovering drug addict, because I hear it and I'm like, woo, trip. I get to ingest, so like to me, like the little red flags go off in my mind where it's like, oh, I could do this under the guise of medicine and it's not a relapse or something like that. But I believe in it at the same time. So I have these conflicting feelings on the topic. So I want to hear from somebody who's really done this and kind of learn.
Yeah, I've done it under different guise. And I'll talk about my most recent one, which was Ibogaine down in Cancun, right?
Okay.
So it's a Ibogaine assisted therapy where they have medical oversight and things. They have doctors and everybody on board. And Ibogaine, I would say, is different. It's one of the most fascinating ones. Now, with these, you say you'll want to, do them. But if you do Ibogaine or Iboga once, you're not going to be like, I want to do that again. You're like, holy shit.
Yeah, you
Can you
say
cuss?
it, yeah.
Holy shit.
Yeah,
Like,
yeah, you can cuss.
I need to step away and understand like really what
What
went on.
happened?
Yeah.
I want to hear more about that, so please go on.
And so this place, it's very well ran. It's ran by Tom Fiegel, and they have a great process, I would say, where you come in and it's a very safe environment. You understand there's doctors there, right? They have preparation where every morning you're meeting, doing like a gratitude circle, guided meditation, breath work, sound healing, things like that, just to get you kind of settled in and in tune before you do the medicine. And then the fourth day, usually you'll go in and you'll take your flood dose of Ibogaine. And it's
what is it? Is it a liquid? Is it something you chew?
it's a
you
capsule.
swallow?
It's a capsule. So Ibogaine is just one of the alkaloids contained within Iboga.
Okay.
Which Iboga is African root bark used.
Okay, I was gonna say it's a plant. Actually,
Yeah,
like
it's a
okay.
root bark used by the Bohidi tribe in West Africa during their ceremonies. So,
Okay.
they just abstracted the alkaloid Ibogaine, which is just one of the alkaloids contained within it, because they found it's very beneficial and useful in treating a lot of different things like PTSD, anxiety, depression, treatment-resistant depression. They're having like 80-90% success rate at treating heroin addicts.
I've heard that on the opioid thing, like the heroin and things like that. Again, it all seems, it's like, I just, you hear things and I'm like 89%, like that's outstanding. Like I worked at a treatment center and it's like, shit, I mean, we had 20%, success rate over the course of a year. It's like that. I mean, this stuff is impossible to treat.
Sure.
And I'm hearing outcomes like that. Like I'm super curious about why that is and why aren't we investing more time into this or looking at this closer?
Yeah.
That's enormous difference.
Yeah, absolutely. And so for instance, Ibogaine's I find it interesting because it's very different from other psychedelics or plant medicines or whatever.
Sure.
That most plant medicines only work on your 5-HT2PA receptors or your serotonin receptors. Where Ibogaine, it resets all your receptors, so your serotonin, your dopamine, your GABA, your opioid receptors, and it stimulates certain proteins within the brain. One called GDNF, which is glial-derived neurotrophic factor, which is essentially like miracle grow for the brain. So it helps it repair itself. Also BDNF, or brain-derived neurotrophic factor, those are both just proteins that kind of assist in repairing the brain. So it's pretty amazing. Like when you go to these places and you see these heroin addicts come in and they're essentially kind of on their deathbed and they're having to keep them on morphine leading up to their dose so they don't go into complete withdrawals.
Wow.
And then they do their flood dose, which is a longer dose, lasts 12 to 14 hours, and then a lot of times they'll do like 2 or 3 booster doses, which is more like 2 or 3 hours. And they'll come out and they don't have any post-acute withdrawal syndromes, like their color, their personality comes back. Of course, that's part of the journey. A thing I would like to see more within the realm of these retreats and retreat centers that I don't think is amplified enough is the integration process.
Okay.
Because, you can get off the physical addiction, right? But then if you return to your environment and you're surrounded by the same stresses, it's like going to a rehab center, you're clean while you're there, right? And I would say this has a better success rate, but I think it can have a higher success rate if that's something that was better or more focused on is the process afterwards and how to give them tools. And so that's one area that I think needs improvement in a lot of these.
I really like where your head's going on this, because in the treatment, to kind of comparatively to what the existing model is for drug and alcohol treatment, it's an inpatient setting. Often the recommendation is go to a sober living home, which is kind of a step down, if you will. So now you can kind of go during the day and live your life, but you come back to a structured environment. We have chores, responsibilities, some random drug and alcohol testing, typically a curfew. And it's kind of a step down process as well. That makes a lot of sense that you can have some great experience when you're down at one of these centers, but then if you just walk back into job stress, your wife's using or drinking or whatever it is, that all that progress could probably get dissolved in a matter of time.
Absolutely, yeah. So that's an area that I think could use improvement from what I've seen.
So you're down there, you take the flood dose, and is that kind of what kicks off, I'm going to just say trip for lack of better term, experience, whatever it is. You're now taking that, you're in a room, are you with other people? I mean, is it, in terms of hallucination, I've taken acid, I've taken mushroom. I mean, sometimes you see visuals, sometimes it's more of an inner monologue, sometimes, you know what I mean? Like I've had different experiences, but I've never taken that substance. What is the actual kind of medicinal experience like while you're doing that?
Yeah, so at Beyond, you're in, two people usually go at a time. You're kind of in a therapeutic room. You're in these hospital beds. They keep you hooked up to EKG and heart rate monitor, keep an IV on you since you're going to be in there all day to keep fluids in you. There's a nurse in there all day watching you. And it starts at about 7 in the morning. Take the Ibogaine, but within about 30 minutes, you'll start hearing some buzzing in your ears.
Okay.
Now you're wearing usually you're wearing like a blindfold. You can take on or off at any point throughout the journey. If things get too intense, you can raise it up, and it kind of just brings you back.
Gotcha.
You have sound canceling headphones on. You're listening to like very therapeutic. Like they focus on frequency, right? Because that affects kind of our brain chemistry as well. So like Icarus or ayahuasca music is a lot of times. Sometimes there's some Bwiti music. And so it kicks in about 30 minutes, and then the first 6 hours is usually very visual. So you have a lot of visuals.
I mean, are there stories going on? I mean, do you have a whole other life that you experience while you're doing this, or am I just seeing trees moving?
It ranged. So I've gone there and done it twice. The first time, it was like rapid images come up. Sometimes images from when I was younger, or just past things, past regressions.
That's intense.
Yeah. Oof. But for me, like I couldn't hold on to an image. It was like just like
fleeting. Yeah.
And it felt like essentially like a mind purge, right? And after that, what I noticed, so I think our greatest addiction is probably our addiction to our thoughts and our ruminating and repetitive thoughts. And so it breaks that thought pattern. So for me, like things that occurred after that was I changed kind of how I guided myself through the world. Like I changed the music I listened to. I was very in tune with how that was affecting my mood and neurochemistry. So I started listening to a lot of the Icarus and ayahuasca music where the frequency is in tune with the body and keeping it in peace. I was careful about the diet, things I watched on TV, just through all senses, right? Things I'm putting on my body. So it gave me a very strong filter as far as what I was taking in, but as well as what I was putting out. But so yeah, so that was it was like a mind purge, like images came up. This last one, it was like, more of one image. It was a story. I don't remember much of that, but I was essentially flying through outer space and I was watching myself and I didn't know what I was. And I was like, am I a hawk? Am I an eagle? What am I?
And you're looking at yourself.
Yeah, I'm looking at myself.
Wow, that's fascinating.
And then I shut up and I was like, oh, I'm a flying phoenix. And then I started going around the world like this and wrapping the world in love, essentially.
Huh.
And so that was like the big image that came up for me. Now then the second 6 hours of the journey it's a very internal analog or dialogue, where for me, like certain words for this last time, words came up in pairs. So the first 2 words were like trust and control. Right after that were scared and alone. So I was like, I tied that back. Grew up in a cult and, other things that had happened. I realized, I have trouble trusting environments or people or things that I can't control, and that stemmed from being scared and alone a lot as a kid. So it's like it gives you those kind of understanding of where those, whether you have trust issues or acceptance of love or whatever, where it came from. So that was essentially, that was this last.
And can you, so obviously you sound like you're able to recall these things pretty well and kind of, they're not just experiences that you don't remember. I'm comparing my drug use, which I'm not comparing it to this. I just forget a lot of these things. It sounds like you experience these things, you internalize them, and then you're taking like real lessons away from that. That's really interesting. Do most people experience it that way, or is it different for every other person? I'm assuming there's other people maybe within your group when you're a center. Do you all talk about this afterwards, or do people just kind of stay to themselves? How does that work? Do you share?
Talks. Yeah, everybody's journey is completely different. There's no some people it's rough for, some people it's easy for.
I hear people get sick. Is this an Ibogaine one that people physically get sick?
Ibogaine, not necessarily. No. Okay. Ibogaine, ayahuasca, or iboga, that's a little more.
Where people actually toss.
Yeah. So
it's really interesting, just because that seems so therapeutic to me. So how do you take those lessons and kind of use them as you're transitioning back into real life, and how are you able to maintain those things? when do you think about it often as you're going through life? Like, what is the transition that you're high on, which I agree with?
Mm-hmm.
How does that kind of happen, and how do you reflect on that more on a day-to-day kind of life?
How do you integrate the process of everything that you learn? That's been a trial for me. Personally, it's been a trial and error. Like I said, I've done it wrong, but I think part of doing it wrong is it's okay. It's not like it's gonna, depending on how you do it, it could mess you up. But for me, it's practices that I've learned over time that I use now to come back and integrate what I've learned. So it's not something you figure out here. Like, we always try to figure out everything in the mind, but it's embodying those practices. So the body is far more intelligent than the mind ever is. So, I use practices like breath work or somatic breath work, which is a way to release trauma, or energy, or just move energy, or things like that. I use, meditation. I'm careful, again, those little things I talked about. What music am I listening to? How is that affecting?
Does that help kind of tap you back into kind of that mindset, those thoughts, those feelings, that emotion, like reconnects you to that experience a little bit, so that kind of keep you? Because I'm just afraid. I'm afraid of a lot. Afraid isn't the right word, but it's like, okay, I come back, I had these incredible experiences, but it's like, I got my daughter, I got the bills, I got to get to work, I got to host a show, I got all these other things, and then you're back into life, and it's like, that was just a thing,
just
not
an experience.
now. Right.
Yeah, it's just an experience, and that's what I see the common issue or mistake. That's why I'm saying there needs to be a process where people are really educated on how to return to normal life, or this.
You've become enlightened in a sense. I don't mean to. I'm not making light of it. I'm really not. I'm genuinely fascinated by this topic. And again, I wish I could do it. I just have concerns about me, Steve, the recovering drug addict, to be able to do this, because I think the insight. And again, just on my recreational stuff, mushrooms especially, I had a fondness for because of the thinking, the mind expansion that I felt, and kind of the connection to nature and the different things that I found through that I really enjoyed. I never really thought about it if maybe it was under a different setting, with clinical therapeutic and all that. That seems like there could be value in that.
Yeah.
I hear about microdosing and stuff now. I'm not putting it down, but it seems to me like a lot of it's just recreational use, but maybe I'm just projecting there a little bit.
Yeah, it depends on how you use anything, right? Anything. And coming back, so when the medicine is, typically it's not always a fun journey. It's not an enjoyable thing, but it becomes easier the more that you can trust and surrender control, right? So that's a big lesson too, especially, and coming back into where we're so inundated with so much that we feel like we have to control to keep our lives together. It's like, I've learned, took me time and time again to learn that, like, when things aren't going my way or as I expected, if I just don't try to latch on and control things more, but if I just surrender, let go, if my schedule slows down, I'm like, this is time for me. I need this time to relax and just surrender and relax. And then when I do that, it's like the universe will respond. Like, things just happen. I don't have to try.
Force it.
Yeah. But it's not an easy thing to learn to do. It's not easy to learn to just let go of control.
That's really, and you know what? Those are things that come up in therapy, but it seems like you have a deeper connection to the actual thoughts and experience because of how you learned those lessons versus just talk therapy. So I'm wondering, it just seems like they sink in a lot more and seem to be much more effective as you carry it on throughout your life than kind of, going for 50 minutes to a person and kind of talking about it.
Yeah. And it affects the way you interact with people, for sure. I mean, I don't really see human beings anymore. I see souls, and it's easy to have compassion and for souls and love different souls. Right? You understand that they're going through the same things that you're going through, and you've been through a lot, and it's just, you're able to relate with them on a different level too.
That's really well said. These are great insights. This is really interesting. A couple other questions just around, some of this. I know I hear Joe Rogan talk a lot about DMT and things like that. Do you have any experience with that? How is it different from kind of the ibogaine stuff? And do you have different experiences, visually, emotionally connecting with that? Is it different than ayahuasca? how do some of these, like, are they all the same? Are they just different versions of each other? Do you have different takeaways, experiences? Would you mind walking me through just a little bit education? Because, again, fascinated, don't know anything about it other than what you see on social media, and I don't trust that.
Yeah.
Right?
Yeah. I think there's a huge component too to working with, like, okay, this one's medically assisted, right? But there's a huge component to working with shamans, and I'm not talking pseudo shamans who've done a couple medicines and claim to be a shaman themselves, but shamans who live in, Colombian jungle, and so who have worked these medicines for thousands and thousands of years. They have a greater intelligence in working with the medicine than we could ever understand scientifically, right? So. There's different component working with a shaman and working in like a medically assisted. And I think both are very therapeutic. As far as experiences, you mentioned Bufo or
DMT or ayahuasca.
Yeah.
Like, again, I don't know the differences in all of these things. I listen to Joe Rogan and I hear him talk about DMT.
Sure.
I don't know if you're familiar, but he's very pro it, and it sounds very intense and very visual and. But then it's like you snap back, and I have no experience in any of that type of stuff. So I'm just kind of curious on these different medicines and the experiences. Are they different? Do they give you similar type of lessons? Is one more effective for PTSD or substance use? Or anything that you have that can share on
everybody
these?
can find their own medicine. Some resonate with other people more than other ones, right? So, but they say medicines have different aspects to them. So a feminine or masculine energy, right? So ayahuasca, they'll say, is more feminine. It shows you the ultimate truths outside of yourself, or the universal truths, and how you're connected to everything. Where iboga or ibogaine is more of a truth seeker within. So it's more of an inward journey. It's more of finding your truths that you've buried down over time. So Bufo or 5-MeO, since Joe Rogan talks about that, I've done that. I did it after ibogaine.
Is that the DMT Bufo? Is that kind of in that same category?
Yeah,
that's what it is?
Yeah, it's the Snoring Dog Frog Desert.
The frog stuff. Yeah. Again, I've
Yeah.
heard this. No idea. I'm like, do people pick up frog? Like, what is going on here? What is this?
Right, yeah. That's a very short and intense journey, I would say. So that's the only one where when you take it, you're not associated with anything in this physical realm. You're gone. You're gone. For me, it was just a white space. It felt like a sense of, in essence, pure consciousness. And it felt like I was a part of everything and nothing at the same time, but more connected to everything than I had ever been. In a way, I say it felt like having dinner with God.
Wow.
is what
That's
it kind of
really
felt
profound.
like. But to take away from it, it really made me realize I just don't know. I don't know anything, right?
It's humbling.
Which is comforting and humbling, right? And I came out of it. When I came out of it, there was I was sobbing and like letting out these primordial screams that I didn't feel like I had control over. So it's just a sense of the way of the body purging certain energies, right?
Wow.
That's what a lot of it is at
It
times.
seems so healthy to me.
Yeah, it is.
Right? That
It
seems
is.
very healthy. I mean, it seems like such a good way to kind of just somehow force that stuff out into the world.
Yeah,
like a purge. I mean,
Yeah, and there's multiple ways to purge. I mean, there's sweating, there's vomiting, there's crying, there's yawning, and so everybody has their own experience with these things.
So you kind of referenced the shaman. I've seen movies and TV shows of what a shaman kind of is portrayed as. What do they do? What is their role in kind of assisting you? Do they give you the medicine? Do they hold your hand? Do they pray with you? Is there chanting? Like how does that work?
Yeah, they give you the medicine, and then they'll usually several of them, and they're playing their Icarus music, and they're just holding space essentially for you. And watching over you and keeping you kind of safe. They truly look at the medicine as a medicine. I mean, they start giving it to their babies when they're 3 years old as a microdose. I mean, like Taito Juanita, one of the shamans I sat with, he became the head of his tribe when he was 7 years old. So for them, it's a very there's a spiritual aspect that I think you get with working with them that you don't get necessarily working with a medical staff. So, and they just have a deeper understanding. They've been working with these medicines for thousands of years, and they can quite literally, I mean, when you see them interact with nature, they have the ability to communicate with nature.
Wow.
Which I'm sure we used to have the ability to do when we had to live off the land and read it to survive, to eat, to
We were more connected
we were
to
more
it than
connected.
going to Walmart
Right,
and
yeah,
just getting
yeah.
something and not knowing where it came from.
Right. Yeah. Yeah. So this environment, this concrete jungle, is not what we're supposed to be in, and not healthy for us, honestly.
That's really interesting. So we got a little bit of time. I could sit here and talk about this all day.
Yeah.
And thank you for your openness and honesty around this. I think this is going to really resonate with a lot of people. Mm-hmm. And I'm sure there are probably a lot of people in the audience who've kind of thought about, embarking on something like this. So let's say, some of the listeners out there, they're curious and maybe this would be something that they'd be interested in. How would they get started? What's a safe way to do it? How do you know or trust a place that you're going if you're interested in kind of pursuing things like this? How do you decide what's good, what's not good, what's a good one of these variations to start with? Maybe walk them through, if they're curious, how do they learn more, what to do, that kind of thing.
I would start first with acquiring like the right tools to be able to prepare you for it, and integration. So simply like somatic breath work, like getting into that, I think that's a great place to start. Not only can it help you with your concerns prior to, it can help you during the journey maintain more
what
of
is
a
somatic breath? Sorry, I didn't mean to interrupt you, but I don't. I don't know exactly what it means. I mean, I do hot yoga this morning and things like that. I've done some of the sound with the bowls where they're doing that. Because I really like the vibration and like that stuff, but I'm not sure I even know exactly what somatic breath work is.
There's just different, to put it simply, there's different breathing rates or patterns that you can do to stimulate movement of cerebral spinal fluid, or to help release. You can get natural DMT releases from doing breath work. I've experienced that as well, which those can be just as profound as doing, especially since you're internalizing it and spending the time to sit with it. So it's just different breathing patterns to take the body different places or release things. And that's honestly like the biggest dysfunction I see in my patients, is they usually have the inability to really use their diaphragm and create intra-abdominal pressure. They're usually taking short, shallow breaths. They're stuck in a fight or flight response walking through their day, basically because of how we have to live.
Sure.
So tools like that, just learning to sit with yourself, guided I love working with medicines, don't get me wrong, but actually one thing I didn't mention is in September, I'm going to Guatemala to do a 6-night dark retreat.
Okay, you mentioned this to me. I was going to ask about that. I wasn't going to let you off the hook about this. I finish your points on just someone interested in this, and then I want to circle back to this night thing. This sounds crazy to me, but I'm fascinated again by it.
So I think before you even go look to do the medicine, like set yourself up for success. Don't just like think in the Western way, I'm just going to go do this medicine and it's going to fix all my problems. It's like have the tools of learning to meditate, sit with yourself, breathe, just simple things like that. Have a community or support, or find an integration coach there's plenty of those out there. You can find them online who can help set you up for this journey. What do I need to be doing? Journaling, before or after. So tools that are going to set you up for success. And then a lot of times integration coaches can guide you on
I was going to say, any red flags of places, and I'm not saying name places not to go, but of like things that if you see online, you're like, I don't want to run into somebody's garage, end up in somebody's garage. I'm a shaman. Bill, you're
definitely, not. I think it's important who you're working with and the environment you're at. Like, it needs to be reputable. Like, you can find it online by searches and reading and doing some research. You can do that much if you really want to go do this, right? Yeah. Do the proper research and understand what you're getting yourself into, and give yourself the tools to set you up for success. So,
any downsides? I mean, I know we've talked about a lot of the positive. Any downsides or side effects or anything, just so we fully kind of lay what it really looks like to people?
I don't know if it's a downside, but I think like after you do these things, a lot of times life may get a little harder, or things may come up it's challenge. It's presenting. Okay, you went and learned this. Now, how are you going to deal with these?
You
address them.
Stuff.
Are you gonna address them face to face, or are you just going to do what you've always done and shove them down? So a lot of times things come up, whether it's internally or externally, that you have to then process, and it's up to you then to do the work to make the long-term changes. So
good.
Yeah.
Okay, you had mentioned to me, I'm so glad you prompted that, because I didn't want to let you out of this chair without doing this. So, and this one does it involve plant medicines or no? This is just...
Yeah, this is just...
Tell me about it. I don't even want to try and describe what it is that you're about to embark on.
Like I said, the plant medicines are very beneficial and useful, but and I've taken myself and made a lot of positive changes with those. But again, I don't want to become like caught in that cycle either. I want to be able to internally, just like with breath work, be able to absolve and understand some of these things on my own. So it's like just taking a deep, you go to Guatemala, you'll spend 2 days, it's a 10-day retreat, you'll spend 2 days preparing for it, doing a lot of meditation, just preparation, journaling, things like that. And then you'll spend 6 days in the dark, no light, nobody around, just you, yourself.
Daytime, nighttime, is this 24 hours, you're in a dark?
Hours, 24 hours, day and night, 6 days.
No cell phone.
No cell phone, no internet, nothing, no distractions, so, and no inputs. And so it's like, I just want to see where I can go without even the use of plant medicines. What can I accomplish, or what can I understand further about myself? So,
do people freak out? I mean, that's intense.
Yeah,
I mean, that's intense. I mean, drugs aside, like that's, I mean, 6 days of me sitting in a room, daylight, and know that, I mean, that's, let alone darkness.
Right, yeah.
I mean, do you lose track of time? Like, what do they say? Like, how do you know? Like,
I don't know. I mean, for me, like people say that, do you lose your mind? I'm like, I hope so. I mean, I've lost my mind a couple times throughout this journey, and that's been probably the best thing. It's
we're gonna have to have you back on after that, just for that one experience. We need like an update so we can push out, because I don't even think most people know something like that exists, let alone like what the actual experiences is.
Sure.
Anything else just in this sphere that you think would be relevant to kind of talk to people in terms of whether it's medicines or retreats or journeys or kind of mind expansion? Like, how does it, what is your experience? What's your takeaways from all this? What have you learned? What would you recommend to people?
Most important thing is, I think it's to be respected, the medicine. And then it's like, don't just go in, because I made this mistake so many times, going in and thinking that it was like, just like Western medicine, I'm going to take this, I'm going to get enlightened. And it feeds your ego. And then you think but you're actually going the opposite way. When you're like walking around, I'm enlightened, I've done this and this and this. Well, that just feeds your ego. You're going the opposite direction. So like, have the tools leading up, understand what you're getting into, and have the process afterwards to integrate what you've learned. Like, go about it the right way. Take your time.
That sounds like a great way to kind of wrap this up is, it's not a cure, and have a plan and work on the reintegration, because that's probably what's going to help make it stick, long term, And as I've gotten to know you, I mean, you're a very mellow and kind of thoughtful guy. I feel like I can see it reflected in you that you've had these experiences, and I appreciate you opening up not only to me, but now to the audience as well, too, because I think that you've probably educated a lot of people. And I think a lot of people have questions around this, because it seems so beneficial, but it's happening in Costa Rica or Colombia or Cancun or these different places. So we just don't have a lot of, eyes and ears as to what it really is. I hear Aaron Rodgers did something in Egypt or something. I don't know. So, I think, I just want to say a big thank you to sharing with me and my audience. And hopefully there's some folks that, get a lot of benefit out of this. Any closing thoughts on kind of this as we wrap it up?
No, I think that's good.
I think that's pretty good, right? Wow, fascinating stuff. This is really good stuff. Well, look, I hope you got out of it as much as I got out of it. This is just a fascinating interview today with my friend Dr. Chris Spencer. If you want to find him, go to Balancing Health Solutions. And he does great work on his real full-time job as PT, chiropractor, physical therapist, all that good stuff. But as a friend who has really made himself vulnerable on the pod today and explained in great detail a lot of these different types of journeys, I think this is 100% worth a listen. Send it out to your friends if you know someone that's interested in potentially kind of going down some of these paths or exploring alternative medicines. Obviously, send them this episode and give it a listen. So, great stuff. Chris, thank you so much for your time today. I really appreciate it. My name is Steve Mokai. I'm the Unlicensed Counselor. Until next time, thank you very much.